Hi, I'm Doug Donnelly. Welcome to Cecil TV. Tonight we welcome Aaron Wright and Lauren Levy. Aaron is from Voices of Hope, and Lauren Levy is the Cecil County Health Officer. And they are here to talk about a program that's part of the Behavioral Health Advisory Council. And they have scheduled a series of listening sessions to hear from the public their concerns. And welcome, Lauren. Welcome, Aaron.
Thank you.
Thank you, Doug.
So, what is the Behavioral Health Advisory Council?
So the Behavioral Health Advisory Council is a county-appointed body that is made up of the former local mental health core service agency advisory council. Every county in the state has one, and it's tasked with ensuring that we have an adequate public mental health system. It is also the local drug and alcohol abuse council, also mandated by state law. Every county has one. And so these have come together to form the local Behavioral Health Advisory Council, recognizing that an integrated approach to both mental health and addiction is really critical to achieving successful outcomes.
I see. And so so tell us about the listening sessions and how will you've already had one, I understand.
Correct,
So,
yeah.
So tell us, what are the listening sessions like?
So what we want to do, first of all, I'd like to say that the council, prior to me becoming chair, really did a lot of work, and we want to continue doing that work. And we are trying to get engaged with like an active council, if you will. A lot of us go to meetings, to have other meetings, and kind of decide things, but we want to get engagement. And what we're trying to do, Doug, was really kind of reach out, because we noticed that within Cecil County, yes, I can name Elkton, that's kind of, places like the Manor and Northeast Lakeside. But there's a lot of other counties in Cecil County. So we wanted to kind of cater our listening sessions to specific towns, right? So you're talking about Northeast, talking about Elkton, Cecilton, Chesapeake City, and a few others. Another thing we noticed, Doug, was that to have these listening sessions, it's not just a person that might have struggled with substance use and mental health or suicide. It affects the family, it affects the community, right? It affects the stakeholders, right? Local businesses, and anywhere from individuals and the youth all the way up to individuals like myself getting a little gray around the sides. Mm-hmm. So we kind of catered these sessions to the towns. We had one in Elkton that was really good. We had a lot of people from the recovery community. We had some elected officials, even a commissioner in Elkton kind of join us and just tell us what the needs are, and also kind of understand what maybe resources that we do have that may not be aware of. And then we're really focusing on the towns of Perryville next on the 29th. We're going to have a listening session because we're talking about our vets, right? Anybody who served our country, thank you for our freedoms. But we really want to hear from those specific people, those specific families, the veterans, the youth, and everybody included.
Right. So since I noticed that the advisory council has a lot of people on it, who's there to listen?
Well, let's see. We have we have someone from County Executive Office, so we have David Trolio, who's appointed. We have law enforcement representation within, I think, certain districts, right? We have Bob Cameron, who's our heroin coordinator. Obviously, Lauren Levy, a health officer. We have a few other individuals from the health department. We have youth. We have Mason, that's representing our youth. I'm trying to think who else.
It's a really broad and diverse group of stakeholders,
Mm-hmm.
and I think that's really part of the overall objective, is really to get diverse perspectives on how we approach these issues. I think we need that diversity of perspective. I think Aaron has brought this enthusiasm and this real desire to revitalize this council and make it a working council. And so having those diverse stakeholders is really critical. Having that different lived experience and people bringing that to bear, and that's part of what the listening sessions are about as well. It's really hearing from different segments of the community, about their experience, the challenges that they are facing, and what ideas and suggestions they have for things that are priorities to address, and what ideas for solutions.
Right.
I think we really want to be focused on working together to develop solutions.
Right. So you had one in Elkton, and did anything come out of that that was new or you did not expect?
Well, I think one thing, obviously transportation is a barrier for accessing all kinds of services. There was a few things, but if we could kind of summarize it up, is one thing I think the community-wide where we need everybody's help is trying to reduce the stigma by normalizing talk around substance use, mental health, suicide awareness. First and foremost, because it just doesn't affect the person, right? Secondly, transportation was one of the issues. Cecil County as a whole, I feel, right, we were more reactive, but now we're trying to be more proactive in solutions to finding when it comes to substance use and mental health. And I think, too, one of the things is sometimes the main focus becomes on the opioids, and we forget about youth and mental health in our school systems, and we forget of counseling and trauma-informed care and generational substance use, generational mental health, and generational trauma. And we don't really want to shed a spotlight on one specific thing. The council is really kind of spotlighting it all, and how can we come all, and then not only just advocate for what we need in Cecil County, but also try to take that to Annapolis, right? Change some bills, change some laws for the good of our Cecil Countyans.
So people should know this is not just about recovery and drug addiction. It's people's mental health and wellness before they get to that point.
Absolutely, yeah. It should not take a family member that might have a 11 or 12-year-old going through some trauma 6 months to get an appointment with a trauma therapist or a counselor. So these are the things that we're trying to advocate for, that we need more of. We need more funding, and we need to make some changes.
Right. So those, you get, after you've listened, you then know what actions you might take.
Right, and I think one of the other things that came out of the Elkton session was really the lack of affordable housing in Cecil County. This is obviously not a Cecil County specific issue. This is a national issue in terms of the affordable housing crisis. But having that conversation with folks who are on their recovery journey, recognizing that this is a huge need and that maybe we need to be more engaged on the policy advocacy side, like Erin was saying, is going to be really important going forward. Making sure that we're getting those resources, not only going to Annapolis, but here at the local level, working with our elected officials. We were delighted to have a member of the county council there, a member of the Elkton Board of Commissioners there, to really hear what the needs are. I think the other really great thing that came out of that Elkton event was just starting to build those relationships. We have a core group of folks who are working on these issues, but really trying to broaden the tent, bring more people into it, and inviting them to participate more actively in the development of solutions.
Right. So you said Perryville is next.
Yes.
And then you'll be working your way around the county.
Yeah, we're trying to schedule it according to when, obviously, the county council member in that district can be represented there, as well as local town mayor and commissioners, or whatever. I guess because sometimes it's not a commissioner, sometimes it's something else in a few other counties. So excuse me, I don't know the term, but we want everybody at the head. We want law enforcement there. We want youth there. We want veteran services there. So I guess the timing, trying to get everybody on board, is a little challenging at times.
Are these in the evening?
Yes, we try to make them in the evening around 6:30 start time. The health department does provide pizza and refreshments, so please do come out. We're very grateful for that. So just trying to get everybody, on one page so we can all listen, and I know it's sometimes difficult.
Okay. All right, and what's the date of Perryville? I won't ask you to tell me all the dates. You don't know.
We don't have all of the dates scheduled
Right.
yet. Perryville is scheduled for next Wednesday, May 29th at 6 p.m. I think doors will open at 5:30, and we'll have pizza starting at 5:30. Really welcome people to join us, engage in some informal conversation before the session starts.
Town Hall?
It'll be at the CHEP
building.
That's actually on Perry Point property, I believe, right as you go in. So it's not in there where all the buildings start looking the same. It is right in there in the beginning. And last one was at the Elkton Rec Center. So we're diverse, right? One might be at a library, one might be at a commissioner's town hall. we're trying to pick in you know, very unique places to do this.
Okay. Did we forget anything? Did we leave anything out?
Just that we would really love everyone to come out. It would be really great to hear from folks, you know, particularly if it's people who have not necessarily engaged in these meetings. I could recognize that if you haven't, it might seem a little intimidating, but it's a really welcoming group of people who are really committed to identifying solutions, and so we really, really want to hear from new voices and see new faces. So that would be, you know, my hope is that we get to see some, meet some new partners.
Great.
Yeah.
Okay. So Lauren Levy, Cecil County Health Officer. Aaron Wright, Program Director, Voices of Hope. We thank you, and good luck with this.
Thank you so much,
you.
Doug.